All right. Is my screen visible? Thank you. Good evening, everyone. Thank you so much for joining us today. All right. Thank you so much for giving us the opportunity to present to you today at IIIT Hyderabad. My name is Keervani Kandala, and I'm a second year integrated MSc student from the University of Hyderabad. I'm also a member of the American Lung Cancer Screening Initiative, or ALCSI as we like to call it. I'm joined by Priyanka Senthil, an undergraduate at Rice University, also a member of ALCSI. Our presentation today will be on lung cancer and lung cancer screening. Thank you for joining, and we are really grateful for the opportunity to present to you today. I'd like to request that everyone is muted during the presentation. We'd love to take questions at the end of the presentation, so please feel free to put your questions in the chat box for us to address. If you're interested in learning more about ALCSI, we'd invite you to our website at www.alci.org, or please email us with any questions at any time. Before I get into the content of the presentation, I'd like to share a little bit about what the American Lung Cancer Screening Initiative does. ALCSI is a non-profit organization that works to raise awareness for lung cancer and lung cancer screening. We are a team of 70 passionate students and doctors located throughout the world. We have worked with various educational institutions, hospitals, and community centers. We hope that by educating about lung cancer and its screening, more people will be encouraged to seek lung cancer screening. Today, we'll be discussing about lung cancer and its screening, addressing questions such as how common lung cancer is, what is lung cancer, who needs screening, etc. So, to begin today's session, I'd like to ask a question. How many of you watch movies? Please raise your hands. All right, okay. So, what is the first thing that we see in a movie? Smoking is injurious to health. It causes cancer. We find so many people suffering from cancer. But what exactly is cancer, lung cancer, and how is smoking related to it? We'll find answers to these questions in today's presentation. Cancer is defined as a disease in which abnormal cells divide uncontrollably and destroy body tissues. So then, what is lung cancer? As the name suggests, lung cancer is a cancer of the lungs. Your lungs are two sponge-like organs in your chest involved in breathing and respiration. Now, the cancer that forms in the tissues of the lung, usually in the cells lining the air passages, is defined as lung cancer. Lung cancer is very, very common. It is the second most common cancer in the world. Lung cancer is of two main types: non-small cell lung cancer, which is less aggressive, and small cell lung cancer that is more aggressive and aggravated due to smoking. Smoking causes most lung cancers, but non-smokers can also develop lung cancer. Well then, what are the causes of lung cancer? Mainly lung cancer is due to smoking. Other causes of lung cancer are exposure to secondhand smoke. That is, even if you don't smoke but you're continuously exposed to it, you have a fair enough chance of developing lung cancer. Then, having a family history of lung cancer and occupational exposure to chemical carcinogens like arsenic, chromium, diesel exhaust, etc., are also responsible for lung cancers. Moreover, infections in lung like pneumonia, tuberculosis, and chronic obstructive pulmonary diseases such as emphysema, bronchitis, etc. also cause lung cancers. New cancer cases in the world in 2020. This graph shows the 2020 statistics of the new cancer cases throughout the world. As you can see, 22 lakh new lung cancer cases were diagnosed in 2020 alone. Now, this graph shows the number of cancer deaths in 2020. Lung cancer was responsible for a total of 18 lakh cancer deaths, causing more deaths than breast, prostate, and colon cancer combined, and causes the maximum cancer deaths till date. These statistics help us understand how much of a serious issue lung cancer is. Now, coming to India, there were 72.5 thousand cases of lung cancer reported. It is estimated by the World Health Organization that by 2040, around 1,20,000 cases of lung cancer could be seen in India, which is like almost double the cases. Now, estimated deaths due to lung cancer in India. There were 66.3 thousand deaths due to lung cancer reported in India. According to the WHO estimates, by 2040, around 110,000 deaths due to lung cancer could be seen in India. This implies that the case fatality rate of lung cancer is over 91.6%. Case fatality rate can be explained as the percentage of the number of deaths from a specific disease over a defined period of time divided by the number of individuals diagnosed with the disease during that time. This has many dangerous implications. Some of the most common diseases such as diabetes, hypertension, etc. have a case fatality rate of around 75%. But for lung cancer, the case fatality rate is over 92%. That is, for every 100 cases of lung cancer, it is likely that around 92 deaths are caused due to it. Chance of developing lung cancer. According to the Cancer Statistics 2020 report from the National Cancer Registry Program in India, 1 in 68 males and 1 in 201 females in India will develop lung cancer at least once in their lifetime, which shows that males are more prone to lung cancer than females. Now, coming to mortality in India, in 2018, around 7,84,821 deaths in India were caused by cancer, of which 8.82% were from lung cancer. Of people diagnosed with lung cancer, 71.4% were men and 28.6% were women. The northeast of the country has the highest incidence of lung cancer because of its high smoking rate. Now we can understand how serious lung cancer is and why is it important to know more about lung cancer and the options available to reduce lung cancer. Now, burden of lung cancer in India. According to the 2020 report, lung cancer and oral or mouth cancers were the most common cancers among males in the Indian subcontinent. A hospital-based study from North India showed that around 90% of patients with lung cancer were diagnosed at an advanced stage of the disease, and there was a delay in diagnostic evaluation and treatment. Creating cancer awareness, preventing risk factors, and early detection and improving access to care among people would cause downstaging of cancer. Now, I'd like to talk a little bit about different stages of lung cancer. So, lung cancer has 4 stages of progression. Early stage or stage 1, where the cancer doesn't spread much to the surroundings or lymph nodes. Localized stage or stage 2 is when it affects the nearby surroundings and spreads to the lymph nodes near the mass. Regional stage or stage 3 is when distant lymph nodes are involved. Finally, distant stage or stage 4 is when the cancer spreads to other tissues and organs beyond the region of its origin. Now, the proportion of patients with lung cancer by stage in India in 2021, we can see that most people are getting screened in distant metastasis state or in stage 3, that is 49.2% in males and 55.5% in females, by which too much of damage would be done. Very few people are getting screened at early stages, that is only around 14.2% in males and 15.3% in females in India are getting screened for lung cancer at the localized or early stage. Now, symptoms of lung cancer. A majority of patients are diagnosed with late-stage lung cancer because they do not start feeling any of the symptoms of lung cancer unless and until the cancer has grown and spread. The most common symptoms of lung cancer are chronic cough, coughing up blood, chest pain, and shortness of breath. Additional symptoms may include hoarseness, loss of appetite, fatigue, persistent lower respiratory infections, and a new onset of wheezing and weight loss. However, when people become symptomatic, the cancer has grown and spread to a point where it is difficult to treat and the prognosis is also poor. If the diagnosis of lung cancer has to wait until the patient has symptoms, it is difficult to catch lung cancer early. So the question that we ask is, how do we catch lung cancer early if patients are asymptomatic? One of the best ways we can do this is through lung cancer screening. Lung cancer screening. Lung cancer screening is done using something called the low-dose computed tomography or low-dose CT scan. If you are eligible for lung cancer screening, it is recommended that you get an annual lung cancer screening. In the coming slides, we'll discuss what lung cancer screening is, who should get screened, and how to get screened. Screening for lung cancer or any other form of cancer involves blood tests, urine tests, DNA tests, medical imaging, etc. An important distinction we want to make with respect to lung cancer screening is that it is done using low-dose CT scan and not the chest X-ray. While chest X-rays are the most common screening procedures, getting screened using an Ldct scan is most recommended. We use Ldct scan because it provides more detailed pictures than chest X-ray and is better at finding small abnormal areas in the lungs. The picture on the left side is a picture of chest X-ray. The yellow arrow points out to the abnormal area in the lungs, but it's unclear. On the other hand, the image on the right is a picture of a Ldct scan of the chest. The red arrow points to the abnormal area in the lungs. As you can see, the image is more detailed than the chest X-ray and enables you to see the abnormal area in the lung with a greater detail. The question that researchers wanted to ask is, how effective is the Ldct scan at detecting lung cancers at an early stage? An important lung cancer screening trial called the National Lung Screening Trial, or NLST, tried to answer this question. The US National Lung Screening Trial, or NLST. The NLST was a large national study in the US with over 50,000 patients. The goal of this study was to determine the effectiveness of using an Ldct scan to detect lung cancer in patients considered high risk for lung cancer. This study included two groups, a group of patients who received the annual low-dose CT scan and a group of patients who received an annual chest X-ray. By comparing the stages at which cancers were caught between these two groups, the study wanted to determine if the low-dose CT scan was better at catching more lung cancers at an early stage. It showed that participants who received screening with an Ldct scan had a 20% lower risk of dying from lung cancer than the participants who received chest X-rays for screening for lung cancer. Now, as you can see, among everyone diagnosed with lung cancers, the low-dose CT caught the most lung cancers at an early stage, while the chest X-ray caught more patients at stage 4. This has important implications for survival. Because the Ldct scan caught more lung cancers at an early stage, these cancers were more likely to be treatable. And the prognosis was also much better. This translates to a 20% reduction in mortality for those who underwent lung cancer screening using Ldct scan compared to an X-ray. There was another study called the Nelson trial, consisted of patients who received an Ldct scan for lung cancer versus the patients who did not receive screening at all. It showed a 24% reduction in mortality in men and 33% reduction in lung cancer mortality in women when compared to no screening. Here, I'd like to explain a bit about treatment methods for lung cancer. So basically, surgery is the most common treatment for lung cancer to remove the tumor. Then we have the radical treatment. Radical treatment is an intensive course of radiotherapy which may be used to treat non-small cell lung cancer if you're not healthy enough for surgery. Then you have the palliative form of treatment. It is a form of treatment for terminally sick people, like when the cancer has progressed so much that the symptoms are treated mostly along with the intended course treatment. And finally, we have symptomatic treatment. Symptomatic treatment is when only the symptoms are treated without addressing the cause or addressing the cancer. This is done at maximum progression of the disease. We see that many patients are being diagnosed at distant metastasis stage and are receiving palliative care, which could definitely be reduced with screening beforehand. So, talking about lung cancer screening, as I explained before, currently there is no lung cancer screening program in India. According to the latest budget 2022, only 2.16% is allotted for healthcare and there is no division for preventable medicine. However, if some money can also be directed towards lung cancer screening, a lot of money and definitely many lives will be saved. For this reason, it is important that we implement lung cancer screening in India because the cost of treatment is less and patients' lives will be saved. It was observed that very few people are opting for getting diagnosed using imaging techniques. That is, only 2% of males and 1.9% of females. Economically speaking, in India, early stage treatment of lung cancer costs around 4 to 7 lakhs, while late stage lung cancer treatment goes up to as high as 34 lakhs. Therefore, up to 27 lakhs can be saved if the lung cancer is detected early. A low-dose CT scan typically costs around rupees 4,000, which can be reimbursed through most insurance plans. Now, as far as the experience of getting a low-dose CT scan goes, It will require you to lay on your back for about 5 minutes. You'll be doing something very similar to the patient in the photo here. One thing to note is that this process will not hurt at all. There will not be any needles or injections involved. The Ldct scan is non-invasive, fast, and completely pain-free. Additionally, the amount of radiation exposure is also very low. Now, current screening guidelines. The United States Preventive Services Task Force has the National Lung Cancer Screening Guidelines based on the NLST trial. Right now, lung cancer screening is recommended if you are between 50 to 80 years old, if you are a current smoker or have quit in the past 15 years and have at least a 20 pack year smoking history. As a reminder, a pack year is defined as the number of packs smoked a day times the number of years smoked. This measurement helps us to calculate the number of cigarettes smoked over a long period. 1 pack year is equivalent to smoking 1 pack per day for an year. Looking at the example in this slide, there are many ways to get up to 30 pack years. If you smoke 1 pack a day for 30 years, you'll have 30 pack years. Or if you smoke 2 packs for 15 years, you'll also, even if you smoke 2 packs for 15 years, you'll have 30 pack years. Now, how to get screened or how can I get screened? Almost all multi-specialty programs in India have screening programs. Almost all multi-specialty hospitals in India have screening programs. Government hospitals such as Tata Hospitals, AIIMS, etc. also have lung cancer screening programs. Private hospitals like Apollo, Fortis Care, Global Hospitals also have screening programs. So usually on the first day of your appointment, you will meet with a surgical oncologist who will confirm that you are eligible for screening based on your age and smoking history. If you are eligible, a low-dose lung CT scan will be performed, which will only take up to 5 minutes. Your scan will be then interpreted by a radiologist who specializes in reading lung CT scans. The patient care coordinator will call you in the following days to explain the results and discuss any additional medical care that may be necessary. As a part of this program, you can receive a second scan the following year and a third scan the year later. So, lung cancer screening saves lives. But a question that you may be wondering is, can individuals get screened for lung cancer during the COVID-19 pandemic, and is it safe to do so? During the pandemic, the number of cancer screenings has decreased significantly, yes. However, lung cancers won't stop because of the pandemic. If a patient is at high risk for developing lung cancer, it is important that they get their annual lung cancer screening test. Right now, most hospitals have operating lung cancer screening programs, and patients can wear a mask about the entire process. If patients follow the necessary precautions, screening during the pandemic is safe. The pandemic should not deter patients from getting screened for lung cancer. Now, we will see why cigarette smoking is not at all advised and why movies show about cigarette smoking. Cigarette smoking is the number one risk factor for lung cancer. It also causes 13 other cancers. Pulmonary disorders such as chronic obstructive pulmonary diseases such as emphysema or heart disorders, etc. are also caused due to cigarette smoking. The tobacco smoke is a toxic mix of more than 7,000 chemicals, and about 85% of lung cancer deaths are thought to result from smoking, and therefore cigarette smoking is not at all advised. Additionally, while lung cancer screening has the potential to save many lives, it is important to address smoking cessation in the context of lung cancer screening. Lung cancer screening is not a substitute for smoking cessation. Smoking cessation, yes, is one of the best ways to prevent lung cancer, and lung cancer screening is the best way to detect lung cancer early, and using both is the best way to fight the disease. For every year after an individual quits smoking, their risk for lung cancer is reduced by 8% to 17%, depending on the kind of lung cancer that they have. However, we do understand that smoking cessation can be difficult, and there are a lot of resources available for people trying to quit smoking. So, well, this is all about what lung cancer is. And now, how can we reduce lung cancers? Lung cancer can be reduced mainly by lung cancer screening, smoking cessation, and avoiding exposure to carcinogens. So, to summarize the presentation, lung cancer is the most common cancer worldwide and has the highest mortality. However, with lung cancer screening, many lives could be saved. Now, As this presentation comes to a conclusion, we want to end on what we, the American Lung Cancer Screening Initiative, are doing to begin the widespread awareness, education, and advocacy efforts necessary to increase the lung cancer screening rate. Lung cancer is the deadliest cancer in the world, and while lung cancer screening can save so many lives, very few high-risk individuals are getting screened currently. We are working to address all aspects of this issue. We wrote and advocated resolutions to be passed in the US government. Additionally, we are working to teach communities across the world about lung cancer and lung cancer screening. Lung cancer is the deadliest cancer in the world, but by working together, we can overcome it and save millions of lives. It starts by working together to raise awareness and initiate lung cancer screening programs in our communities. We believe that by educating communities, especially students, about lung cancer and lung cancer screening, it will be crucial to lowering the number of deaths associated with the disease. Students greatly impact and influence the healthcare of their parents, and we hope that by educating students about the important measures that can be taken will not only be able to help the students but also their family members and on a wider range their relatives. If you are interested in helping us raise awareness about lung cancer and lung cancer screening, please reach out and we'd like to work with you to save lives. Now, we are open for questions. Thank you so much for listening to the presentation. Any questions?
We're happy to take questions via the chat or by just unmuting. So any method is good for us.
Oh, there's a question in the chat box. Are floor cleaners carcinogenic? Priyanka, would you like to take this question?
Sure. So the floor cleaners definitely have some chemicals. Whether they're carcinogenic is going to be dependent on which floor cleaners we're talking about. And in most cases, they should not be carcinogenic because they do have to go undergo some testing and regulations that need to be overcome before they can be available to the public. So most should not be. If they have not undergone that testing or that regulation, then there's a chance that they could be.
Any other questions? Also, we hope that we gave a good idea about what lung cancer and lung cancer screening is. So if there's anything that we can do to tell more about that or any other thoughts or questions that you'd like to share, we are open.
Hello, ma'am.
Yes, sir.
Ma'am, could you hear me?
Yes, sir. We are able to hear you.
Ma'am, definitely, I'm a person who definitely like to socialize in the society. So out of my social life, I could observe a couple of lung cancer patients where I think they are not here now. I think they expired after suffering from lung cancer for a couple of years. So what is the time that even after, my first question is, even if a person has no bad habits and he is so hygienic in nature, I mean, so disciplined in food, so such person I could able to see was suffering from lung cancer, and ultimately he died. So even after being so consistently a disciplined person, so how is that possible that lung cancer has affected such person?
I'll take this question. Firstly, I'm very sorry about your loss, sir. So Getting lung cancer has like there are so many ways of getting lung cancer. It's either due to, if there's lung cancer in the family, then there's a fair enough chance that the person may get lung cancer. Apart from that, if the person is exposed to smoking, or I mean, even if he doesn't, but he's exposed to smoke, then he has a fair enough chance of developing lung cancer. And on top of that, most lung cancers are getting are getting diagnosed at late stages, that is at third stage or fourth stage, where very less could be done to treat the lung cancer. And therefore, even if there is no fault in the person, there is the so it couldn't be treated. Priyanka, would you like to emphasize a bit more on this?
Yeah, sure. So I think you hit on all the points, Keervani, but like she was talking about, there can be a familial risk or a genetic risk for lung cancer if a family member or relative has lung cancer, and so that could increase someone's chance of getting lung cancer. And additionally, the additional risk factors for lung cancer, we know that smoking is the #1 risk factor, but there are also still other risk factors like exposure to secondhand smoke, exposure to radon and asbestos. So especially if someone is working in an environment where they're exposed to more of these carcinogens, that could also increase their risk for lung cancer. And so that is a reason why a person could get lung cancer without while generally being healthy. And another reason that I think your part of your question was asking about survival. And so the survival for individuals diagnosed with lung cancer varies based on the stage that it's diagnosed at. And so Keervani showed us a graph where if it's diagnosed at stage 1 or earlier stages of disease, then the 5-year survival, or the likelihood of patients surviving at least 5 years after initial diagnosis, is high. It's around like 80%, but that drops significantly as the stage at which lung cancer is diagnosed increases. And so at stage 4 lung cancer, the likelihood of surviving 5 years after initial diagnosis is 6%. And so a lot of different factors go into how long a person may survive after being diagnosed with lung cancer. But I hope that answers your question. And thank you for asking.
Yeah, thanks for addressing this question. So my last question is, see, there are many people in the society who have been diagnosed with lung cancers, but they are poor in nature in terms of financial availability. So going to the government hospitals and getting the treatment is something everybody knows how difficult it is, because there will be a huge crowd. Is there any such foundation who will help those needy poors and who needs treatment? At least with minimal cost, minimal possible cost. I'm not saying free, but I am saying which should be somewhere in the middle, like it's not like government cost and it's not like a private, something, a charity sort of thing, and a foundation who can help them get out of this in cancer treatment.
That's a great question. And right now, unfortunately, I don't think there is something like that. The United States has somewhat of a national screening program where individuals who are low income or over the age of 65 can get insurance from Medicare or Medicaid, and that will cover the cost of screening for patients who meet the eligibility criteria. But unfortunately, in India, there isn't a program like that in place right now, and that is where I think efforts to increase awareness about lung cancer and organizations working towards making lung cancer screening more accessible will need to come together to make that more possible. So I'm really hoping that will be something that we can accomplish in the future. But right now, I don't think that is there is a program like that in place. And Keervani, if you want to expand on anything like that because you're in India yourself, feel free to.
Thank you. So in India, apart from the government hospitals, like there are the Tata Memorial hospitals, which are like semi-government and which are like not completely government. Like there is the TMC in Mumbai, TMC in Visakhapatnam, and these hospitals basically they also mentor other hospitals. Like there is this, as far as my knowledge goes, there is the Basavatarakam Indo Cancer Care Hospital in Hyderabad as well, which is under the mentorship of TMC, the Tata Memorial Center. There are a lot of hospitals that way. So those
Yeah,
hospitals.
I
Sorry,
have
what's
been to
that?
Basavata, but the expenditure still was on the higher side when I went 5 years ago, maybe. So I'm just thinking a little bit lower than that Basavatarakam. That's what my plan.
Yes, sir. So like the like I was saying, the Tata Memorial Hospitals, they have like they basically, as far as I know, three categories or something, like the government category, the private category, and and another thing where it is for the economically poor. So like when I was in TMC, I have seen that, and so the people belonging to the government category or the economically poor, I think their treatment was like mostly funded. So the Tata Memorial Hospitals are a good place for getting treatment for lung cancer, and are more affordable. In addition to that, as far as my knowledge goes, they also like pay for the treatment. I mean the fare, the traveling expenses are also paid. So I think maybe you can look into that. So
Sure.
that's what
Thank
I'd like to say about that. So thank you.
Thanks a lot, man. Great information. So I'll conclude my questions.
Thank you, sir.
And I think there's a question in the chat. If you want to address this, or I can take it too. Someone is asking, if one has already reached the later stages of lung cancer, is it worth treating them, especially poor who cannot afford?
You can take the question.
Okay, sure. So I think that is a great question, and that is something that will probably need to be decided by the patient and their family, because there are a lot of different factors that can affect how, like, the outcome. And so when as we talked about in the presentation, when someone has later stages of lung cancer, oftentimes surgery is no longer an option because the cancer is always spread from the location from where it originated, and surgery is no longer a possibility. And so at later stages of lung cancer, oftentimes chemotherapy, immunotherapy, radiation are the ways that we will treat the cancer, and all of those options can reduce the likelihood of the tumor spreading, and can also shrink the tumor in some cases. And so it's more of a way to control the cancer from spreading further. And so as to how worth it is to do that treatment for especially people who are poor, I think that is something that the patient and the family will need to decide based on their own circumstances and the risks and benefits that they are willing to take. I think it'll be different for each patient. So I don't think there's a one like blanket statement or answer that we can make on that. Oftentimes these treatments are expensive, and people will often undergo several rounds of chemotherapy or radiation therapy. And so and the outcomes are also variable for each patient. And so how much money the patient wants to spend, and what risks and benefits they're willing to take is something that the family will need to decide. Keervani, do you want to add anything to that?
Yeah. So also the reason why, one of the main reasons why the patient is getting screened, or if a patient is already reaching later stages, is because he's not diagnosed at an early stage, and for that, getting diagnosis at early stages would definitely be helpful to prevent situations like this from happening. So yeah, that's what I'd like to say.
Right, exactly. If the patient has been getting screened regularly, then it's more likely that the lung cancer will be diagnosed at an earlier stage, and at that point, prognosis is going to be better, and also treatment options are going to be better. So, if it's diagnosed at stage 1 or stage 2 in earlier stages, then surgery is oftentimes an option, and that often results in the best outcome, since it's the surest way to remove most of the tumor. So that is why that's one of the reasons we are advocating for lung cancer screening.
We hope that answers your question. So, thank you, sir. Also, Prabhakaracharya sir, there's a link in the chat box about the TMC hospitals that I was talking about. Maybe you can look into them.
Hello?
Sorry, sir.
Ma'am, I didn't get you.
I have sent a link in the chat about the TMC hospitals that I was talking about. So they have a list of all the government and hospitals that are under their influence, which actually provide subsidized treatments.
Thank you. Ma'am, how can I access this? After this meeting, can I access this chat box?
Oh yes, sir. If necessary, I can send you an email.
Sure, sure. So you can send to Vishwanath. I can share across my community.
Okay. Yes, sir. Yes, sir. Thank you so much. Or you can always reach out to us. I'll send the details to Vishwanath, sir.
Sure, sure. That's great. That's great. That would be better.
Thank you, sir. Any other questions?
There is one question in chat, I believe. Shatrunjay Rawat sir has sent in chat. Can you please?
No, sir, it was not a question. It was a statement for your question.
Okay.
Thank you, sir.
I missed it.
All right. If there are no other questions, then I think we can conclude the presentation. Priyanka.
Thank you everyone for joining, and thank you for the questions. It was a really nice time talking with you all and answering all.
Thank you so much, Professor Anil Kumar and Prasad Krishnan, Professor in charge of NSS at IIIT. And thank you so much, Dr. Prabhakar M, for helping us with the presentation. And we love talking to all of you. Thank you so much for this opportunity, and we'd love to hear from you. Thanks again.